Welcome to Ally Solutions. Ally Solutions presents Autism: Unlocking the Spectrum, Intervention Approaches and Practices. Autism: Empowering Approaches for Supporting Autistic Individuals. Therapeutic Approaches: Personalized option addressing unique needs. Autism therapy can vary significantly depending on the individual's unique strengths, challenges, preferences, and needs. There is no one-size-fits-all approach to autism therapy. Each autistic individual is different and may respond differently to various interventions. However, a personalized approach that uses proven methods and teamwork and focuses on the person's strengths and interests leads to the best results. Critical components of autism therapy include collaboration and coordination. Autism affects many parts of a person's life. Helping autistic individuals involves therapists, teachers, doctors, and behavior experts, who are all vital for providing comprehensive assessments and tailored interventions. Effective collaboration and communication are essential to ensure that interventions are consistent, integrated, and aligned with the individual's goals and needs. Early intervention. Research has shown that early intervention is critical for improving outcomes for autistic individuals. Early intervention for autism should start as soon as it is suspected or diagnosed. It can improve long-term outcomes by addressing developmental delays and supporting essential skills in communication, social interaction, and behavior. Standard services include speech therapy, occupational therapy, behavioral interventions, and tailored developmental interventions. Evidence-based practices. It is crucial to utilize interventions and strategies that have demonstrated effectiveness through rigorous research and empirical evidence. Evidence-based practices for autism therapy may include applied behavior analysis (ABA), social skills training (SST), speech and language therapy, sensory integration therapy, and cognitive behavioral therapy (CBT). Family involvement and support. Families play a crucial role in supporting autistic individuals and can significantly contribute to therapy success. When families and caregivers receive education, training, and resources, they become empowered to understand and effectively support their autistic loved ones, promoting more substantial and positive long-term outcomes. Flexibility and adaptability. It is critical to recognize that therapy needs may evolve and adjust interventions accordingly. Being flexible and responsive to the changing needs and preferences of autistic individuals ensures that therapy remains relevant and practical throughout their lifespan. Holistic approach. A holistic therapeutic approach is essential to effectively and comprehensively address an autistic individual's needs. Autism affects many areas, and when the interplay between different domains of functioning, including communication, social interaction, behavior, sensory processing, and adaptive skills, is fully considered and appreciated, a holistic approach can lead to more meaningful and sustainable improvements. Person-centered planning. Person-centered planning is crucial for autism therapy. It involves creating individualized intervention plans based on the autistic person's strengths, preferences, and goals. This planning requires collaboration between the autistic individual, their family, and a team of professionals to set priorities, establish goals, and design interventions that enhance independence, autonomy, and quality of life. Strengths-based approach. Recognizing and building upon an autistic individual's strengths and interests is essential for promoting positive outcomes and maximizing their potential. When therapists focus on fostering strengths, they encourage self-esteem and self-confidence, empowering autistic individuals to participate actively in their therapy and decision-making process. Therapeutic approaches. At a glance. Collaboration and coordination. Multidisciplinary strategy meeting diverse needs. The collaboration and coordination approach in autism therapy recognizes that autism affects many aspects of an individual's life. By emphasizing the importance of teamwork between therapists, teachers, doctors, and behavior experts, this approach provides thorough assessments, tailored interventions, and comprehensive individualized support to autistic individuals. Critical therapeutic aspects of collaboration and coordination include communication. Open and effective communication among team members is essential for successful collaboration and coordination efforts. Professionals share updates, progress reports, and relevant information to ensure that everyone involved in the individual's care is informed and working towards common goals. Comprehensive assessment. Professionals collaborate with the individual to conduct a thorough assessment of their strengths, challenges, preferences, and needs, including communication, social interaction, behavior, and sensory processing. This collaborative assessment, which respects the individual's role, provides a holistic understanding of the individual and informs the development of personalized intervention plans. Consistency and integration. Effective collaboration assures that professionals work together to ensure interventions are consistent, well integrated, and aligned with the individual's goals and needs. By sharing a common purpose, they communicate regularly and share information. This coordination across home, school, and therapy settings secures trust that interventions support each other, providing continuous support and making the interventions more effective. Goal alignment. Professionals collaborate with the individual and their family members to establish clear goals and priorities for therapy. By aligning interventions with the individual's goals and preferences, therapy becomes more meaningful and relevant, enhancing motivation and engagement in the therapeutic process. Tailored interventions. Based on the assessment findings, the multidisciplinary team collaborates to develop highly individualized intervention plans that address the specific needs and goals of an autistic individual. Each professional contributes expertise to design interventions that target areas of difficulty while capitalizing on the individual's strengths and interests. In summary, collaboration and coordination involve a diverse team of professionals and stakeholders, maximizing interventions' effectiveness and promoting positive outcomes for autistic individuals. Early intervention. Addressing developmental delays through personalized support. Early intervention efforts recognize the importance of addressing developmental delays by providing specialized support and services to children as soon as signs of autism are detected or diagnosed. This approach focuses on acquiring and supporting essential developmental skills, including communication, social interaction, and behavior. Critical components of early intervention in autism therapy include collaborative approach. Early intervention efforts involve collaboration among professionals, including therapists, educators, physicians, and other specialists, as well as coordination with community resources and support services. This multidisciplinary team approach ensures that intervention strategies are comprehensive, coordinated, and aligned with the child's goals and needs. Comprehensive assessment. Early intervention efforts start with a thorough assessment of the child's strengths, challenges, and developmental needs. Professionals conduct assessments to identify areas of delay or difficulty, and to establish baseline skills for monitoring progress over time. Continuity of services. Early intervention services aim to provide continuous support as the child grows and develops. Transitioning between different intervention programs or services may be necessary as the child's needs change. Evidence-based practices. Early intervention programs typically incorporate evidence-based practices that effectively support autistic children. These practices can include applied behavior analysis, ABA, speech and language therapy, occupational therapy, OT, and social skills training, SST. Other early intervention programs may include the Early Start Denver Model, ESDM, or the treatment and education of autistic and related communication handicapped children, TEACH. Family involvement. Family involvement is a central component of early intervention in autism therapy. Parents and caregivers are actively engaged in the intervention process, receiving education, training, and support to help them understand their child's needs, implement intervention strategies at home, and advocate for their child's needs within the community. Holistic support. Early intervention programs address the holistic needs of the child, including their physical, emotional, and social well-being. Therapists and professionals work collaboratively to promote overall development and improve the child's quality of life. Individualized intervention. Based on assessment findings, individualized intervention plans are created to address the specific needs and goals of an autistic child, with their early intervention services tailored to their unique profile, preferences, and family priorities. Building on the child's strengths and interests, these plans may include a combination of therapies and interventions that are tailored to address areas of difficulty, such as applied behavior analysis, ABA, speech therapy, occupational therapy, developmental interventions, and social skills training. Intensity and consistency. Early intervention services are structured and intensive to maximize effectiveness. These sessions are frequent and targeted, with professionals working closely with the child and family to practice new skills. They ensure consistent learning opportunities across different settings, such as home, school, and the community. Timely identification. Early intervention begins with the timely identification of autism signs and symptoms. Healthcare professionals, educators, and parents play a crucial role in recognizing early signs of autism, such as delays in speech and language development, social difficulties, repetitive behaviors, and sensory sensitivities. In summary, early intervention recognizes the critical importance of early identification of autism. By providing timely individualized intervention services and specialized support, early intervention efforts aim to help autistic children reach their full potential and enhance their quality of life. Evidence-based practices. Systematic effectiveness through proven science. Evidence-based practices rely on interventions, strategies, and techniques backed by rigorous research and empirical evidence. As systematic effectiveness evaluations have shown, these practices have produced positive outcomes for autistic individuals. Critical aspects of evidence-based practices in autism therapy include comprehensive approach. Evidence-based interventions cover multiple areas affected by autism, including communication, social skills, behavior, sensory processing, and adaptive skills. Examples of evidence-based interventions include behavioral interventions, such as applied behavior analysis, ABA, social skills training, SST, speech and language therapy, occupational therapy, OT, sensory integration therapy, and cognitive behavioral therapy, CBT. Evidence-based interventions may also include developmental interventions, such as the Early Start Denver Model, ESDM, or the treatment and education of autistic and related communication handicapped children, TEACH. Continuous evaluation. Continuous evaluation involves ongoing assessment and monitoring of an intervention's effectiveness to ensure that it remains appropriate and effective over time. Therapists regularly assess progress and adjust interventions based on changing individual needs and responses to treatment. Family involvement. The concept of family involvement recognizes the importance of involving families in the therapy process and empowers them to actively support their autistic loved ones. Families receive education, training, and support to implement strategies and techniques, at home and in other naturalistic settings, to reinforce consistency and generalization of skills learned in therapy sessions. Focus on effectiveness. Focus on effectiveness prioritizes interventions that improve communication, social interaction, behavior management, adaptive functioning, and overall quality of life for autistic individuals. Professional collaboration and development. Professionals from various disciplines, including therapists, educators, physicians, and behavior specialists, collaborate and undergo continuous training to ensure that comprehensive, coordinated, professional, and ethical standards of care align with the autistic individual's goals and needs. Research foundation. Evidence-based practices are grounded in empirical evidence from high-quality studies, including randomized controlled trials, systematic reviews, and meta-analyses. Tailored interventions. Tailored intervention plans address the unique needs, strengths, challenges, and preferences of each autistic individual. Therapists and professionals carefully select interventions based on the individual's assessment findings and specific goals, ensuring that interventions are relevant and appropriate for the individual's needs. In summary, evidence-based practices prioritize interventions and strategies that have been scientifically validated and shown to be effective in improving outcomes for autistic individuals. By employing these practices, therapists and professionals can provide high-quality and individualized care that maximizes the potential for learning, development, and independence. Family involvement. Significant and active participation. In autism therapy, the family involvement approach acknowledges the significant role families can play in the lives of autistic individuals by emphasizing their active participation in their treatment, support, and overall well-being. The family involvement approach typically involves the following: collaborative partnership. Therapists, educators, and family members collaborate to develop tailored treatment goals and strategies based on individual strengths and challenges. Education and training. Families receive education and training about autism spectrum disorder, empowering them to understand their loved one's diagnosis and provide practical support. Emotional support and advocacy. Families receive emotional support and guidance, including counseling and resources, to navigate the challenges of raising an autistic child while advocating for their educational and community needs. Generalization of skills. Therapists work with families to apply the skills they learned in everyday settings, reinforcing progress outside therapy sessions. Long-term planning. Family involvement extends to long-term planning for the autistic individual's future, including transition planning and preparing for increased independence and responsibility as they grow and develop. Skill building. Family members learn practical strategies to assist in communication, social skills, and behavior management, promoting the autistic individual's independence and self-regulation. In summary, family involvement recognizes the importance of a collaborative and holistic approach to supporting autistic individuals, with the family playing a central and active role in the therapeutic process. Flexibility and adaptability. Positive reactions to environmental changes. Flexibility and adaptability therapy addresses the specific challenges many autistic individuals face when dealing with new situations, transitions, or unexpected changes. Flexibility and adaptability aim to enhance the ability of autistic individuals to adjust their thinking, behaviors, and responses to environmental changes by incorporating the following: building tolerance for uncertainty. Many autistic individuals struggle with uncertainty and unpredictability. Therapy helps them gradually become more comfortable with uncertainty by exposing them to new situations in a supportive and structured manner. Developing coping strategies. This therapy teaches autistic individuals techniques to manage transitions, routine changes, and unexpected events. Methods may include using visual supports, social stories, and practicing new situations to prepare for changes. Supporting emotional regulation. Autistic individuals learn strategies to manage anxiety, frustration, and other challenging emotions that may arise in response to changes or unexpected events. Promoting generalization and maintenance. Therapy teaches autistics to understand the thoughts, feelings, and intentions of others, enhancing their ability to adapt to social expectations and comprehend different perspectives. Encouraging perspective taking. Therapy teaches autistics to understand the thoughts, feelings, and intentions of others, enhancing their ability to adapt to social expectations and comprehend different perspectives. Promoting problem-solving skills. Autistic individuals learn problem-solving skills to address unexpected challenges and find solutions independently. Techniques involve breaking tasks into smaller steps, brainstorming solutions, and considering consequences. Understanding differences. Therapists play a crucial role in recognizing that each autistic person has unique strengths, challenges, preferences, and sensory sensitivities. They tailor interventions to meet each individual's needs, ensuring a personalized approach. In summary, flexibility and adaptability therapy empower autistic individuals to navigate everyday challenges effectively. It achieves this by developing flexible thinking skills, coping strategies, problem-solving abilities, and emotional regulation skills. Holistic approach. Beyond symptoms and behaviors. The holistic approach considers all aspects of an autistic individual's life and well-being. It goes beyond targeting specific symptoms or behaviors by recognizing how different factors interconnect to influence their development, functioning, and overall quality of life. The holistic approach typically utilizes the following to focus on an autistic individual's comprehensive needs. Consideration of developmental trajectories. Holistic therapy recognizes that the individual's needs and challenges may evolve as they grow and develop. Therapists adjust interventions accordingly to support the individual's ongoing progress and well-being. Promotion of environmental supports. Holistic therapy focuses on creating supportive environments that facilitate the individual's growth and participation in daily activities. Environmental supports include visual support, consistent routines, and positive relationships with family members, peers, and caregivers. Family and caregiver involvement. Family and caregiver involvement is essential for a well-rounded therapy approach. Therapists collaborate closely with family members and caregivers, helping them actively participate in therapy while providing valuable insights, applying strategies at home, and advocating for their loved ones' needs. Promotion of integration and balance. Holistic therapy encourages integration and balance in an autistic individual's life, seeking to alleviate symptoms and challenges by enhancing their strengths, resilience, and self-worth. A multifaceted approach. Holistic therapy addresses various dimensions of the individual's life, including cognitive, emotional, physical, sensory, and social well-being. Interventions may target academic abilities, communication skills, emotional regulation, motor skills, self-care, sensory sensitivities, and social interactions. Incorporation of multiple therapeutic modalities. A holistic approach may utilize different therapeutic techniques and interventions, including behavioral, cognitive, occupational, play-based, sensory integration, and speech therapies. Utilizing mindfulness-based approaches, therapists tailor these interventions to suit the individual's specific needs and preferences. Applying understanding of the whole person. Therapists use a holistic approach by seeing the person beyond their autism diagnosis. They take the time to recognize each individual's unique strengths, challenges, preferences, and life experiences. They also consider factors like personality, interests, family dynamics, and cultural background. In summary, a comprehensive and person-centered holistic approach to autism therapy recognizes the complexity of the individual's experience. By holistically addressing the individual's needs, holistic therapy aims to empower them to lead fulfilling and meaningful lives to their fullest potential. Person-centered planning. Individual prioritization. Person-centered planning focuses on the individual's preferences, strengths, goals, and aspirations. It emphasizes the importance of involving the individual and their family members, caregivers, and support network in decision-making processes related to their care, treatment, and support. Person-centered planning often includes collaborative decision-making. Collaborative decision-making emphasizes collaboration among the individual, family, caregivers, and support professionals. Everyone's input is valued and respected, and decisions are made based on the individual's preferences and goals. Continuous review and evaluation. Person-centered planning is an ongoing process that regularly reviews and evaluates the individual's progress and outcomes. This ensures the support plan remains effective and responsive to the individual's changing needs and priorities. Customized support. Based on the individual's strengths and goals, interventions and support services are tailored to meet their needs by involving various therapies, educational programs, vocational training, community resources, and other supports aimed at helping them achieve their goals and lead a fulfilling life. Flexibility and adaptability. Person-centered planning recognizes that the individual's needs, preferences, and goals may change over time. The planning process is flexible and adaptable, allowing adjustments and revisions to address the individual's evolving needs and aspirations. Identification of strengths, preferences, and goals. Person-centered planning begins with identifying the individual's strengths, preferences, interests, and goals by conducting assessments, gathering information from the individual and their support network, and understanding their unique needs and objectives. Person-centered planning promotes inclusion and community engagement for individuals. It seeks to identify opportunities to participate in community activities, develop social connections, build relationships, and contribute meaningfully to their community. Individual autonomy and empowerment. Person-centered planning places the individual at the center of the planning process, respecting their autonomy and right to choose their own life. It seeks to empower individuals to control decisions that affect them, promoting self-determination and independence. In summary, as a therapeutic approach, person-centered planning prioritizes an individual's autonomy, preferences, and goals, promoting active participation in care, treatment, and support decisions. By focusing on the individual's strengths and aspirations, person-centered planning aims to empower them to lead a meaningful and fulfilling life on their terms. Strength-based approach. Supporting capabilities over challenges. The strength-based approach centers on recognizing and nurturing an individual's unique strengths, talents, interests, and abilities rather than solely focusing on their challenges. This approach acknowledges that autistics possess distinct capabilities that support their development and well-being. This approach includes building self-esteem and confidence. The strength-based approach enhances self-esteem and confidence by emphasizing an individual's strengths. Acknowledging their abilities and achievements fosters a positive self-perception and pride in what they can accomplish. Encouraging growth mindset. The strength-based approach encourages a growth mindset, emphasizing that effort and practice can develop and improve abilities and skills over time. This fosters resilience, perseverance, positive learning, and a personal growth attitude. Fostering positive relationships. The strength-based approach fosters positive relationships between individuals, their therapists, family members, caregivers, and peers. Recognizing and celebrating the individual's strengths makes these relationships more supportive, nurturing, and collaborative. Identifying and acknowledging strengths. The strength-based approach begins with identifying and recognizing the individual's strengths, talents, interests, and abilities. This is done through assessments, observations, and conversations to understand what the person excels in and finds enjoyable. Promoting independence and self-advocacy. The strength-based approach fosters independence and self-advocacy skills. It involves identifying their needs, preferences, and strengths, empowering them to advocate for themselves in different settings and situations. Setting achievable goals. The strength-based approach includes setting realistic goals that match the individual's strengths and interests. This promotes motivation, active participation, and a sense of purpose as the individual strives toward meaningful objectives. Tailoring interventions to strengths. Tailored interventions and support strategies focus on an individual's strengths by incorporating their interests and talents into therapy sessions. These strategies use strengths-based activities and exercises and provide opportunities for individuals to showcase and further develop their abilities. In summary, the strength-based approach in autism therapy promotes a positive and empowering perspective by focusing on the individual's strengths and potential for growth. This approach helps autistic individuals build confidence, achieve goals, and lead fulfilling and meaningful lives.